Hey everyone, welcome once again to my YouTube channel. And before I go on, I would like to remind you to please like this video and don't forget to subscribe. And if you know you are gaining from these videos, which I from this channel, which I believe you are, or I hope you are, don't forget to share to others that might be in need of the information here. Last time I spoke about what depression means and how to identify the various signs and symptoms that might indicate that you have or someone you know might have depression. Today, I'll be talking about the types of depression and treatment options for depression. There are various forms of depression, but I'll be listing some of the most common types today. First of all, we have the major depression. A person with major depression experiences a constant state of sadness and they may lose interest in various activities that they used to enjoy. Treatment for this type of depression usually involves medication and psychotherapy. You also have the persistent depressive disorder. This is also known as dysthymia. Persistent depressive disorder causes symptoms that last for at least 2 weeks. A person with this disorder may have episodes of major depression as well as milder symptoms. So it is like a combination of both major depression and minor depression or depression with milder symptoms. We have also have bipolar disorder, which I've talked about in a previous video. Bipolar disorder involves being manic and depressive. So depression is a common symptom, a very common symptom of bipolar disorder. And people with bipolar disorder may have symptoms of depression around half of the time. This can make it difficult to distinguish between bipolar disorder and depression. And we also have psychotic depression. Some people that experience psychosis may also experience depression. Psychosis can involve delusions such as false beliefs or having a detachment from reality, and it can also involve hallucinations, that is, seeing things or sensing things that do not actually exist. Then there's also postpartum depression, which is when women that have just given birth experience what some people call the baby blues. Their hormone levels readjust after childbirth, and changes in mood can result from imbalance in their hormone levels. Postpartum depression or postnatal depression is one of the most severe types of depression, and it can persist for months or years. Anyone ongoing depression after giving birth should seek medical help so they do not harm themselves or their children. And there's also major depressive disorder with seasonal pattern. This was previously known as seasonal affective disorder or SAD. This type of depression is related to reduction in daylight during probably rainy season or winter. It lives during the rest of the year and just comes when when a person is in a dark area or very in moody weather conditions such as heavy rain and stuff like that. People who live in countries with long or severe winters seem to be more affected by this condition. We all have mentioned, if you suspect that you have symptoms of depression or anyone you know has symptoms of depression, you should seek professional help immediately from a doctor or a mental health specialist. There is nothing to be ashamed of in seeking help. It is for your own benefits and for the benefit of your loved ones. As opposed to some beliefs, depression is treatable, and managing depressive symptoms usually include three things. First is support. This can range from discussing solutions and possible causes to family members so they can help to support the depressed person. Can also undergo psychotherapy, which is also known as talking therapy, and drug treatments, which has to be prescribed by a doctor, which include antidepressants. I hope you have all learned a lot from this video, and next time I'll be talking about how you can love yourself, or how to love yourself more, because self-love is very important in avoiding or treating depression. Don't forget to like and subscribe to this channel. Bye.